1 in 5 families has a child with special needs.
I've had the pleasure of being a pediatrician on the Norwalk Hospital staff for almost 38 years now. And in this time, we've seen an increasing amount of children with special needs. We all know about the explosion of autism in children on the autistic spectrum, but we have so many more children with psychological and social and emotional disorders. We do see a lot of ADD, ADHD, and we have many children with learning disabilities, as well as children with Down syndrome, cerebral palsy, and other disorders.
When you have a child with special needs, you're focused on learning as much as you can to help them be their best. And for Jack's case, that means a lot of interventions, speech therapy, occupational therapy, PT, all sorts of other things that may help him along in his development.
We first realized that there was something wrong with Chad. Something wasn't 100% right, probably at 2 months old. We started seeing doctors starting here in Connecticut, and we've seen probably 4 or 5 different neurologists from Bridgeport to New York to Yale to Hartford. It took a little while for Chad to get a diagnosis.
As a parent, it's important to leave absolutely no stone unturned. It's critical to get the best care, no matter where it is, in order to get the best possible outcomes and the best possible offer of an opportunity of a great life for our children.
Parents who have children with special needs have a hard time finding specialists and coordinating care for their child. Norwalk Hospital is about to change that.
Right now, the care is very fragmented for the family and for the pediatrician. We get reports back at various times and with a lot of delay. Specialists don't hear from each other, there's no interconnectivity. And for the poor families who have to drive their children to New Haven, Hartford, Manhattan, White Plains, and other places for their care, they spend countless hours in the car.
Normally, with young children, you're focused on home activities, and that's your base. But for us, I would say over the last decade, we've been focused on car activities, and that's the nature of finding the best specialists for your child and going wherever they are.
Mondays, we have a private physical therapist who comes to the house. On Tuesdays, we pick her up and rush up to Wallingford, Connecticut for the best craniosacral therapist in the state. On Wednesdays, we rush off to Westchester County for a sensory occupational therapist. On Thursday, we rush off to the pool for aquatic therapy. And on Fridays, sometimes we do a social group and sometimes we just stay home and relax.
The vision of the Pediatric Therapy Center is that we'll be able to provide comprehensive care to our families and to our children under one roof. We felt that that was really important to make it accessible to all and to have a multidisciplinary approach, which I think really makes us unique. The new center is going to provide developmental screenings and assessments. It will provide a variety of therapies such as speech therapy, occupational therapy, and physical therapy. And additionally, it will also provide support services for these very special families. We have collaborated with the Department of Pediatrics at Yale and specifically the section of Developmental and Behavioral Pediatrics. In addition to that, we've also sought the expertise of a leading clinical psychologist from our very own community who specializes in autism and Asperger's. I couldn't be more thrilled that everybody shares this sentiment, that it's important to take care of the whole child. Not in pieces, not separately, but together in a team approach.
Imagine fully integrated care under one roof and close to home.
As a working mom, I work 2 jobs. I have 3 children. It's very difficult to stay on top of all of Chad's needs, doctor's appointments, therapies, tests. To have a team that can help me and let me be a part of his care would be so helpful, and I think that would benefit Chad so much.
When the idea of a one-stop shopping center was presented for all different types of pediatric therapies, my initial reaction was, wow, that would be so convenient. And wouldn't that have been nice to have when Jack was very young. In those early years, you're really looking to learn as much as you can, and you learn from all the different therapists as well as the parents. So bringing together under one rooftop all the different disciplines of therapy and medical needs is invaluable for parents because they get the professionals, but they also get to interact with the other parents. And that in and of itself is part of the educational process for the parents.
Lauren is 14 years old, and we've been doing this for quite some years, finding the care that is absolutely critical to her success. But what a life changer it would be to have one center provide all of the care for new families, families who are just receiving a diagnosis or having an inkling of a thought that something might not be exactly as they had dreamed. A center with full comprehensive care would make all the difference to these families as they go on their journey.
Good things happen when communities come together.
I first got involved in the Pediatric Therapy Center when I had a conversation with Kim Coletto and Tom Baccia, and we pulled Neil Hackman into the picture to help us form a center like the one Norwalk Hospital is doing, and we were calling it the Healing Hearts Pediatric Therapy Center. Norwalk embraced this concept and ran with it and is making this a reality, and what's so wonderful is the Healing Hearts recreational program happening in Stamford is pairing up with the center, so we're doing more than just medical intervention for kids. We're also doing a huge recreational and social piece.
We've had a lot of community collaboration with organizations such as Healing Hearts and our community task force that's largely comprised of community leaders, many of whom may have children with special health care needs, and we heard their voice. They've given us a lot of valuable input as far as what our community's needs are, and we've taken that input and we've created what I think is a very unique program.
Please help support the new Pediatric Therapy Center for Children with Special Needs.
Join us.
Join us.
Come be part of something special. Help support the new Pediatric Therapy Center at Norwalk Hospital.
Thank you.